Paracetamol, it's probably in every medicine cabinet in the country. We use it for fevers, for aches and pains. But here's something you really need to know. If it's not used correctly, this common remedy can be seriously dangerous. So today, we're going to break down the emergency plan for paracetamol poisoning in children. This is a crucial guide for any parent or caregiver. Okay, let's get right into it. So, how can something so helpful turn into such a threat? Well, it really all comes down to the dose and, most importantly, the timing. See, when the body gets way too much paracetamol, the liver, which normally processes it just fine, gets completely overwhelmed. And when that happens, it starts producing a really toxic byproduct that literally attacks and kills liver cells. That's the hidden danger we're trying to prevent. And here's the part that's truly frightening. A child might seem perfectly fine for a day or two after an overdose, but on the inside, that toxic process has already started. The obvious, scary signs of liver failure, they don't show up for 3, 4, even 5 days. And by then, the damage can be severe. That's why what you do in those first few hours, it's absolutely everything. So how does this even happen? Most of the time, it's a total accident. A parent might accidentally give another dose too soon, or maybe they use the wrong strength for the child's age. Sometimes a toddler gets into a bottle of that sweet-tasting elixir. For older kids, it can sometimes be a case of deliberate self-harm. But no matter the cause, the result is the same. The liver is put under serious, serious risk. Okay, this is the number. This is the one you need to remember. 150 milligrams per kilogram. If a child has taken this much or more based on their body weight, it's an immediate trigger for emergency action. Medical teams don't wait around. They start treatment right away. This is the critical threshold. Right, so what happens the moment you suspect an overdose has occurred? Well, those first few hours become a race against the clock. It's this carefully coordinated effort to stop the poison in its tracks before it can do that lasting damage to the liver. And this timeline here, it lays out that race perfectly. It all kicks off at hour 0, the moment of ingestion. Then you've got this crucial window from 1 to 4 hours for what's called decontamination. At the 4-hour mark, that's when a key diagnosis happens. And from 8 hours onward, it's all about the antidote. Every single one of these steps is time-sensitive. Let's walk through them. First things first, and this is non-negotiable, you get to a hospital or call for emergency help immediately. You absolutely do not wait for symptoms to appear. Once you're there, the medical team's #1 priority is gastric decontamination. Fancy term, but it just means getting any of that unabsorbed poison out of the stomach pronto. And the go-to method for that is activated charcoal. If they can get it into the child's system within 4 hours, it acts like this incredible sponge just soaking up the paracetamol before the body can absorb it. It's most effective in that very first hour. Now, making the child vomit is a backup plan, but honestly, it's way less effective than the charcoal. So once decontamination is underway, we hit a really important moment in the timeline, that 4-hour checkpoint. This is where doctors can finally move from just suspecting a problem to getting a crystal clear diagnosis of just how much risk the child is in. Now, you might be wondering, why exactly 4 hours? Why not sooner? Well, if you test the blood too early, you might not catch the peak level of the drug after it's been absorbed. And that could give you a falsely reassuring result. It could trick you into thinking everything's okay when it's not. This 4-hour blood test is the gold standard for knowing exactly what they're up against. But they don't stop there. Along with that paracetamol level, they need the full picture. So they'll check something called prothrombin time, which tells them how well the blood is clotting. That's a key liver function. They'll also check liver enzymes and kidney function to get a baseline and watch for any early signs of stress on the organs. All right, so the tests have confirmed the risk. Now it's time for the most important step of all, the antidote. And here's the really good news. There are incredibly effective treatments that can completely prevent that liver damage. But, and it's a big but, they have to be given in time to work. Doctors basically have 2 main tools in their toolbox here. Option 1 is an oral antidote called methionine. They might use this if the child is conscious, isn't vomiting, and it's still within 8 hours of the overdose. But if more than 8 hours have passed, or if the child is vomiting or unconscious, they go straight to the standard of care, an IV infusion of something called acetylcysteine. And that IV protocol, especially for little kids, is incredibly precise. It starts with a big loading dose, given over just 15 minutes to get that protective antidote into the system fast. That's then followed by 2 more infusions at slower, controlled rates over the next 20 hours. The whole idea is to provide this continuous shield for the liver while it recovers.
So the antidote is flowing, but the job's not done yet. The final stage is all about careful, close observation. It's about watching and waiting to make sure the liver is recovering and that the worst has been successfully dodged.
But what if a family gets to the hospital late, say a day or even 2 after the overdose? Well, there is still hope. In those cases, doctors will start that same IV antidote, but they'll keep the infusion going, sometimes for much longer than 20 hours, until the blood tests finally show that those liver enzymes are trending down. That's the signal that recovery has begun. In this right here, this is what's really at stake. These are the signs of liver failure that this whole protocol is designed to stop. Jaundice, which is that yellowing of the skin and eyes, abnormal bleeding or bruising because the liver isn't making the stuff that helps blood clot, and encephalopathy. That's a state of confusion and severe irritability because the failing liver can't clear toxins from the blood. This is exactly why every single minute counts. And look, all of these life-saving protocols we've just talked about, they're not just guesswork. They're based on established, proven medical guidelines from expert sources like the Illustrated Textbook of Pediatrics and the World Health Organization. This is the official roadmap to recovery. So, we've walked through the entire emergency response plan. You know what to do if the worst happens. But it really all starts at home, doesn't it? Knowing the plan is one thing, but preventing the accident in the first place is the real goal. So take a second and think, are the medicines in your home stored safely, securely, and completely out of a child's reach?